the chairman of the International Neuropsychiatric panel that coined the term TAND and later developed the author. He was the author for the TAND checklist. He was the chairman of the Society for the Study of Behavioral Phenotypes, an international interdisciplinary research organization from 2008 to 2017, and also was on the WHO ICF CY steering group for autism spectrum disorders and ADHD under the chairmanship of Professor Sven Holt. He is also the treasurer of the International Association of Child and Adolescent Psychiatry and Allied Professions, where he also coordinates the Helmut-Remschmidt research seminars. I know there's a lot that I have to cover, so he is an associate editor of the Journal of Child and Adolescent Mental Health, co-editor of the International Association of Child and Adolescent Psychiatry and Allied Professions monograph, and is also on the editorial boards of Autism Research and the Journal of Intellectual Disability Research. He has been actively involved with many TSC user and carer organizations over the last 21 years, including the TSA UK, TS Alliance, TS Deutschland, and in August and September 2018, he also did a road show with TSC Australia and New Zealand on the TAND. I really want to ask you more about that because that sounds very interesting. In 2014, he was also awarded the Manuel R. Gomez Award for his contribution to tuberous sclerosis complex. So we are all very excited to hear everything that you have to say. I'm sure we're all ready to ask a lot of questions. Thank you. Thank you.
Good, and I see more people have arrived.
Yes.
Well, thank you. I just wanted to check. Are you happy for us just to talk without the mic? Does our cameraman want us to use the mic?
Everybody wants the
I
mic.
don't mind.
He was saying that if we take the mic, then he can get
Is it better for you if we use the mic? Would you prefer that? Is it on? It feels strange for us because we're such a small group to talk with the mic, but I understand if the... Okay, is that a bit... As long as it's not too loud for you. Is it okay? And is it better for the camera? Are you happy? He's happy. Okay, hopefully. Good. I always think it's a little bit embarrassing when people read out all that kind of stuff because it sounds a bit overwhelming. But today is not about me. Today is about us. So I would actually quite like just to find out a little bit who's in the room. And I want to ask, so I'm going to just go around and ask all of you to introduce yourselves and maybe tell me if you have, because we're a small group, we can ask lots of questions and, I don't want to stand here in front of you for 3 hours, Shoba. So we can have more conversations. So maybe each of you can also say if you have a specific question, something that you came today that you want us to talk about or that you want to learn. You get one question, just to say. For me to get a sense of where people are at and what you're interested in talking about. Does that sound all right? And then I can go on again. So let's start with, and more people, welcome. Is it a rabbit? Is it a bunny? It's an Easter bunny, yes. I didn't know there are Easter bunnies in India. How sweet. Good. Okay, shall we start on your side, given that you've done the introductions? Is that all right? Yes. We'll let them, that'll give them a chance to settle in as well. Good. So tell us your name, where you live in India, and a bit about your profession and why you're interested in TSC and why you're here today.
Do I also need to use the mic? Yes. Can people hear me clearly? Oh, for the camera. Okay, it's not because we're there. Okay, if I'm too loud, just tell me, please. Good morning. My name is Pavitra Desai. I'm from Mumbai. I am a psychologist. I work at Kokilaben Hospital, and I think just started seeing some of the patients with TSC. I've seen more of, I think, the clinical cases coming in with different kinds of concerns. And I think my purpose of coming here primarily is to obviously learn from you, since you've come up with the TAND checklist, but also the kind of plan that you all follow after you've done the TAND. So what would be a specification or let's say a program that you have after the TAND has been administered? Okay.
Yeah, good morning. I'm Dr. Anjali and I'm a parent. I have a daughter 9.5 years old who has TSC and I come from Ludhiana. So I have come here just basically to learn about TAND and said there are so many behavioral issues with my daughter. So I would like to see where like she stands in the TAND checklist and what can I do for her more. Thank you.
Good morning, I'm Suvarna. I'm from Hyderabad. I'm basically a researcher and a therapist. I work at Butterflies in Hyderabad. So my main question is, like, I could see a lot of features, the characteristic features of autism in TAND. So where do we specifically cut a point, like, this is TAND and this is autism features? So I just want to know about it more. Thank you.
Good morning, everyone. I'm Preeti, and I am a gynecologist by profession. I work with the Delhi government setup, and I am also a TSC parent. My son is 9.5-year-old with TSC, and I am attending this conference for the first time. So I wanted to know more about TAND and also where we stand today treatment-wise, and what should be the protocol that we should follow for the follow-up of our children. Yeah, I'm talking about the medical treatment per se. Yeah, yeah. Okay. Yeah.
I'm Parul Viparthi. I'm from Hyderabad. I'm a TSC parent. My daughter is with me, 12 years old. And I'm here for TAND to understand more and how can I help more later on after administrating.
No. Hey guys, I'm Namrata. That's my daughter who's suffering from TSC. So I am basically here just to understand more about TAND and how would the future would be for my daughter behavioral wise, I just wanted to understand that. Plus I also wanted to meet other TSC parents and you and wanted to understand more about this program. I hope this would certainly help my daughter, and that's it. Yeah, I was there.
And she has beautiful things in her hair. But why did we skip to?
Oh, let me introduce them. That they are my parents. They are just supporting me to help my daughter. So I have just got them with me.
Hello, good morning. I am Narendra Saraswat, ex-Chief of Security, Coal India Limited. I have come with my daughter to see what this place is, what she can get from you, especially from you and Dr. Desai, and what help she needs. Thank you.
She doesn't want to speak.
Do you want to say hello in Hindi?
That's what I'm telling. Aap namaste bolo na.
Hello. Good morning.
Good morning, everyone. I'm Monica. I'm from Delhi itself and working as a child psychologist with Mom's Belief. And I'm here to learn about TAND.
Just tell us 2 words about Mom's Belief.
Mom's Belief is an organization which makes home plans for the parents, those who have children with special needs, ADHD, autism, learning disability, Down syndrome, and childhood disorders, basically. So the home plans, because mothers can take care of child and they are there for the children rather than therapists like all the time. Hello, myself Sakshi Kansal, and I also stay in Delhi, and we both are colleagues. So I also work as a child psychologist. And TAND is a very new term for us because we have been working with a lot of other disorders, and we are basically trying to empower parents with autism, ADHD, because we feel that what mothers can do for their kids, no one else can, the way they can treat. And you know, we have so many parents here, and I hope you all will agree to it. The way you work, nobody else can do that. So we would like to understand what it's all about. So it's a very new thing for us. So looking forward to it.
Good morning, my name is Karan. I'm a TSC parent. I live in Delhi. And I just want to know more about the TSC. That's why I came here.
Good morning, everyone. My name is Imani Satija, and my daughter, her name is Alishka. I'm from Delhi, and I'm working with Sun Life. Medical claims. It's all about for Canada what to do. And I have came here to understand more about TAC so that I can help out my child better way, and to learn about TAND also, and the best treatment I can give to her. That's all. Thank you.
Good morning. Wow, there are more parents. How nice. Welcome. So we have a full room, I think. Please, aaiye. Okay, my name is Shobha Shivastav. I'm a parent of a 25-year-old young adult with tuberous sclerosis and autism. And I had an organization called SOPAN, which is Society of Parents of Children with Autistic Disorders, which is based in Mumbai. I've been working in this field for more than 20 years. I'm a special educator. And TAND is very interesting because when I came to know about it, it talks about parents, it talks a little bit about what they may also go through. And so I want to know the history, what has happened in other countries after TAND. Right? Here we are just introducing it. We hope to roll it out in India sometime by the end of this year. But what happens after that? The care after that is most important. So for me, that is the biggest question here. Yeah?
Hello everybody, I'm Rahul. I'm a TSC parent. For me, TAND is like a very interesting concept. When I was introduced to it like about 6 months back, basically, as a parent, I'll talk as a parent, I was feeling lack of understanding amongst the psychologists on how they will approach my child, because the whole profile of her cognitive behavioral psychiatrist was not getting captured, you know. They were kind of focusing on one particular aspect and saying, okay, let's give a treatment to this. But I could clearly notice that like some are appropriate, some are not appropriate. So she was getting kind of stereotyped into various buckets. And even in the school, she is facing that same problem, you know. There are many instances where she could be with like a normal class, right? But yet she'll get dumped into a remedial class, you know? So I was hoping like one, we can increase the awareness amongst the psychologists, and second, I would like to know how this can, the TAND checklist can serve as a conversation starter between the psychologist and the parent. Because as a parent, for me, it's very difficult to figure out what is the normal behavior of a child and what is coming out of the TSC. So where I should put my foot down and say like, no, you can't do this, and where I know she can't help herself, you know. So that is for my understanding.
Lots of difficult questions. Just before we give to the next new mum and dad, about the grandparents who didn't want to say hello. You must remember, grandparents are often a secret weapon in families, because grandparents have a very important role, very good for support, for encouragement, to help mum and dad, etc. So you are very important people here. So that's why I was conscious when the mic got past you, when in fact you might be very important. So let me hand over to our new visitors.
मेरा नाम अनिल सोलंकी है, ये मेरा बेटा है. ही इज़ ऑलमोस्ट 9 year old. इसको बचपन से ही ये प्रॉब्लम है. तो हम तो फर्स्ट टाइम ही ये लेकिन इसके ऑलमोस्ट सारे बड़े बड़े हॉस्पिटल में हम दिखा चुके हैं इसको, लेकिन आज भी मतलब इसको कोई प्रॉब्लम है नहीं। अभी भी फिट्स दिन में 3 से 4 फिट्स आते हैं। कभी कभी फिट्स इतने लंबे होते हैं कि 10-10 मिनट 15-15 मिनट का फिट्स आता है इसको, सीजर्स। तो वो तो आज तक रुक ही नहीं पा रहे हैं। हमने काफ़ी RML हॉस्पिटल, बहुत बड़े बड़े हॉस्पिटल, मैदानता हॉस्पिटल, अभी एक डॉक्टर क्या नाम है,
डॉक्टर विनीत गुप्ता, अपोलो।
हाँ, अपोलो हॉस्पिटल में विनीत गुप्ता जी बैठते हैं, विनीत भूषण। तो उनसे दिखा रहे हैं, 2-3 साल हो गए हैं ऑलमोस्ट। तो कोई चेंजेस कुछ भी नहीं आया, मतलब कुछ भी, मतलब हाँ डिले हो रहा है इसका। 2 साल तक ये नॉर्मल था, जब तक तब तक इसके बिहेवियर में इतना चेंज नहीं था, बोलता भी था, लेकिन उसके बाद से धीरे धीरे बिल्कुल स्लो हो गया एकदम। इसकी डेवलपमेंट बिल्कुल बैक हो गई है। तो अभी तो इसकी दवाइयाँ चली रही हैं, लेकिन कोई इम्प्रूवमेंट तो अभी तक नहीं हुआ है।
He still gets fits. 3 per day, na? 3 per day. He gets 3
ज़्यादा भी
long 2 months. Pretty long fits, and we've been to many places, and of late there is a decline in his so they see a kind of so we are here. तो आप यहाँ आए हैं, वो सवाल पूछ रहे हैं हमसे कि आप यहाँ से क्या, उनसे क्या सवाल है? कोई सवाल है तो स्पेसिफिकली वो बताइए। हम सब ने एक सवाल उठाया।
मेरा ये जानना है कि क्या ये कभी नॉर्मल हो पाएगा?
उसकी कोई दवाई है जो इस बीमारी को ठीक कर सके?
Is there any medicine which can?
And why don't you introduce yourself, Tim?
मेरा नाम उर्मिला है, ये मेरा सन है, और बस मेरा एक ही क्वेश्चन है कि ये नॉर्मल बच्चों की तरह इसके फीट्स बंद हो जाएं, उसकी कोई मेडिसिन है जिससे कि मतलब इसका ट्रीटमेंट प्रॉपर तरीके से हो सके? पर क्योंकि जो भी हम न्यू एडमिशन स्टार्ट करते हैं इसकी, उसका मैक्सिमम 2 डेज असर होता है, फिर उससे बैक चला जाता है उल्टा।
इसके दौरे चेंज हो जाते हैं, मतलब
फीट्स मतलब एक वन टाइप का नहीं होता, डिफरेंट टाइप के होते हैं जो मेरे को भी समझ नहीं आ पाते कई बार।
Thank you. And so maybe, well, so firstly, welcome to everybody, and it's lovely. Oh, I'm standing on the camera. It's lovely to have so many people with different stories, both mums, dads, grandparents, some professionals. Great to have so many psychologists. Often it's hard for us to find so many psychologists, so thank you all for coming. Now we just need to get the psychiatrists and the speech therapists and the occupational therapists and all the other therapies as well. But I completely agree with you about the principle, which is the same for us in Africa where I work, that the primary job that we should do is to give power and knowledge and expertise to families, because families are with their family members all the time. And particularly for us who work in India and live in India or Africa, we will never have a therapist to do all the jobs that we need. So the more we have skills, the better we can seek out what we need, but at least not feel disempowered in that sense. Just a general comment maybe to start with, and if you, I don't know how well you understand English, your English understanding is pretty good. Say if I talk about things you don't understand, just ask, or ask us to stop. We have many people who can translate. Number 2, we have some children here, so do not feel embarrassed or shy if you need to get up and go out, or play with them on the floor, or as long as they don't play with a camera, I think pretty much anything else is fine. So I want to give you permission to get up and move around and do things if you need to. Don't worry about that. We're all used to it. So we have to look after them first. That's our first job. The other thing to say is we will mainly focus on the neuropsychiatric aspects of TSC today. So we will not, I wasn't specifically planning to talk about things like fits or the other physical features, etc. of TSC. As you know, one of the challenges of tuberous sclerosis is almost every bit of your body can be affected. Your skin with all sorts of skin things that we've seen, your brain with all the growths and the epilepsy and things like that, your heart, sometimes that's how people are diagnosed first. The kidneys, many people have kidney lesions. In older people it can be the lungs and so on. And for all of those we now have plans, we have some treatments, we have some medication treatments that can be very useful. I'm not going to talk about that in the big group, but days like today have extra goals. So firstly is for you to meet one another. And when you might say, I'm looking for a good doctor, Shoba or somebody else might say, where do you live? Why don't you contact these people to help you connect to people in the TSC community? And you will know that better than I will, because I don't know the Indian system so well. But the second thing is also, in a meeting like this, even though we're small, we will talk more about general principles than any one child specifically or any one person specifically. I'm happy for us to talk about, you know, if we have time to talk one-to-one during breaks and so on, but we're unlikely to solve an individual person's difficulties today, but we can talk about principles and ideas that you can think about in more detail amongst yourselves or with your team or with your doctor, or if we have time together. So just to make that differentiation. Is that a useful start? Does that give you permission to ask and comment as you want? The reason why we started to develop this big focus specifically on TAND is because around the world people are getting much better at diagnosing tuberous sclerosis, at treating the skin, treating the kidneys, treating the epilepsy, and for most people life is much better now than it was 20 years ago in tuberous sclerosis, because we know so much more. Now the challenge is to give that information to all the people around the world, and that's I think why Shoba and the TSC of India came along, to make sure that in this country and in this part of the world you have knowledge and information, not just parents but also to give to the doctors and the clinicians. But what we discovered is that people were getting quite good at treating the physical features of tuberous sclerosis, but they really weren't understanding all the difficult behaviors and all the developmental things and all the challenges. And those are the things that are the greatest difficulty for most mums and dads. The epilepsy is a problem, the kidneys are a problem and so on, but it's the developmental stuff, it's the difficult behaviors, it's the struggles in school, it's the autistic things. Those are the things that are the most difficult for families to live with. And that's why we decided to make this specific, to think how can we communicate the importance of these things. And that's what we'll focus on mainly today. All right. Look, she wants to say something as well. So what I thought I'd do is start with some background information about TAND. So in the first session, we'll just talk a bit about what do we mean by the concepts and the ideas, and feel free to ask. Then we will talk a bit more about the actual TAND checklist that you've heard about. How many of you have not seen a TAND checklist? Okay, so some of you. And so we've got some copies, I'll hand those out in a minute. There are lots of handouts for people, and and thank you Shoba for printing all these things. I also made a copy. Raul did it. Thank you. There's also a copy, and each of you can take one, or I mean you can use them as you like, of a recent paper that we wrote that just summarized all the things that we're talking about today. So if you don't remember everything, it's all written down in a way in here as well. And I don't know what you're doing with the recording. Will you make that available to families as well? Fabulous. So that people can access that. So that's absolutely fine. Great. So let me maybe get started. I'm going to ask Shobha and Raoul to tell us when it's tea time. So because we're a small group, we'll talk until it's tea, and then we'll talk until it's lunch, and then we'll talk until it's time to go home. All right? So let me then start by firstly saying greetings from my city, which is Cape Town. I don't know how many of you have been to, have any of you been to South Africa? No? But here you can see, that's Table Mountain, the famous Table Mountain, and in the middle here is the University of Cape Town. So those are the main buildings, beautiful location at the University of Cape Town. And now you can't see it so well, but the architecture is quite similar to many Delhi buildings, because as you know, many buildings in Delhi were designed by the South African architects Herbert Baker. So Herbert Baker and Edwin Lutyens did a lot of the buildings in the city where we are. So that's why it looks a bit similar. And I'm in the Division of Child and Adolescent Psychiatry. I'm the academic head. And these are our buildings. So this is exactly where we work. My office is right here in the front. So you can see we have a beautiful place. And in fact, we have a number of houses in our site. We don't want to look like a hospital because I think it's scary for children to go to a place that looks like a hospital. So this is one of the clinical buildings. I'm sitting in my office looking out. This is my view from my office. But you've also heard from the introduction that I spent about 20 years living in Cambridge. So I did medicine in South Africa, but then I did all my psychiatry and child psychiatry and Ph.D. in the UK, in Cambridge. And I still have my house in Cambridge. That's where I've just come from. But that's also where my story with tuberous sclerosis started. In 1997, that's a long time ago now, I was looking for a project to do my Ph.D. in. And I was interested in finding, because I was interested in the developing brain, what goes wrong with the developing brain, how it influences people's behavior, genetics, and things like that. Somebody suggested to me, why don't you do a project on tuberous sclerosis? And I knew almost nothing about TSC then. And 21 years later, I'm still doing research and work in TSC. And I hopefully know a little bit more about it now than I did 21 years ago. So I don't know, anybody here who had a diagnosis in 1997 or around that time? You're a little bit before, just before, yeah. So we've had a long journey with TSC, and I can tell you, so the good thing, if I start with the good news, life for people with TSC today is very different and much better than it was 21 years ago. We've had incredible breakthroughs and discoveries in terms of treatments, understanding, the community, etc. So I think the quality of life for people now is very different from even 21 years ago when I started doing this work. And I just wanted to show you one other picture before we get going. And this is a picture of a woman called, is the light all right? Is it fine for you to see? Most of it will just be words, so it shouldn't be a problem. This is a picture of a woman called Lauren Leclésio. And Lauren was a neuropsychologist, a developmental neuropsychologist who worked with me. She did her master's degree with me in Cape Town and then her PhD. And a lot of the work on the TAND checklist was done by Lauren. So she was there with me from 2012, and she helped the development of the checklist and the validation and some of the work. A lot of what I will talk about today was done by her. And this is beautiful. She was a beautiful, beautiful woman, husband, 2 beautiful children. And Lauren last year developed, or was it the year before, Shoma? Not too much, just a little bit. Yeah, as I say, it can stay. I'd rather you can see me, so it's not such a big problem. Let's see. But the reason I wanted to show the picture of Lauren is firstly to acknowledge that a lot of the work we'll talk about today was done by her. But the second reason is Lauren developed, in 2017, she developed malignant melanoma. And she died a year ago at the age of 36. So she was a beautiful young woman who had done all this amazing work for the TSC community. So it's also just not to start the day on a negative note, but to just start the day firstly with gratitude and acknowledgement of her amazing work. And just for all of us to remember that life is short and we must do the things that we are passionate about, because we never know when it's going to finish, right? So think of Lauren and the amazing work that she's done as we go through the day. Right, let me ask you some questions. Let's start with a bit of a quiz. What does TAND mean? Is it the Afrikaans word for tooth? Afrikaans is my native language. Is it a tooth in Afrikaans? Is it an Austrian word for beautiful but useless? Or does it stand for TSC-associated neuropsychiatric disorders? What do you think? C? Any other offers? Okay, it shouldn't get darker. Is this better? In terms of the screen, but I don't want you to fall asleep. That's not good. And I don't want to fall asleep either. So actually it's a trick question because all of them are correct. It's a tooth, and apparently it means beautiful but useless in Austrian. But it is also TSC-associated neuropsychiatric disorders. And I'm going to come back to tell you why we made up this word in a minute. Second question. When we, in the UK, when we asked mums and dads and people who live with TSC in 2010, how many of them do you think had ever received any treatment or diagnosis for TAND? 18%, 38%, or 68%? Very few, a proportion, or most? What do you think? This is in the UK. Very few, yeah? So you think it was this one, yeah? Yeah? Actually, you're absolutely right. It was less than 20%. So this was in the UK. These were all people who were members of the TSC organization in the UK. So even not that many years ago, in Britain, people struggled to get any diagnosis and any treatment for these things that we're talking about today. Next one, TOSCA. How many of you have heard of the TOSCA study? The TOSCA study is a big international study of tuberous sclerosis. We have just over 2,000 people across the world in this study, and we're using it to look and describe all the difficulties and challenges that people have. When we looked at the TOSCA study, how old do you think were the children with TSC when they were typically diagnosed with autism? For those of you who know about autism, we try to find children as young as possible, because the earlier we can catch them, the more we can help shape their development. So what do you think was the average? 3 or 5 or 7 years of age? In this study, in TOSCA. You're right, it was 7. So even though we knew that children with TSC had a 50-50 chance of having autism spectrum disorder, they weren't diagnosed until they were 7. Many years after we would expect, we would like them to be diagnosed. Can we treat TAND? What do you think? Well, I hope so. Otherwise, we're going to waste your time today. And we'll talk about that. Often people think we can't treat these things, but I do think, and we're also at a place where we can do very specific targeted treatments. But what the challenge for us in tuberous sclerosis, and I don't need to tell you because you're mums and dads and grandparents, is TSC is complicated. So the trick is firstly to understand all the different bits, and then to think, so what can I do about all the different bits? So that's why we break it up into different sections as well. So let me now come back to TAND. Oh, is there going to be a game? Yes. So what I thought I'd do is just to tell you a bit about why we made up this term, TAND. And then I'll say something about the checklist. We'll talk much more about the checklist after we've had a cup of tea. And I thought it might be useful just to tell you a little bit about some of the research that we're doing, because that will also give you a sense of what will come for the next few years, because I think that's a helpful, and what we hope is actually that you might be part of some of our research in the coming years. And then in the afternoon session, we'll have a conversation about treatments. That will be much more a discussion between us, because the first thing is I don't have all the answers, and secondly, treatments also depend very much on what's available where we live. So you will have to help me think about, well, what are the treatments available in your city or your province or your part of the world. So firstly, let's come about why we made up this word TAND. Does anybody want to guess why we made it up? Because it wasn't getting identified? Yeah. Because it's the most challenging, yeah, so people were hiding from it, yeah, okay. He's going to try and change the camera to be on you, and by the time the camera is on you, I will be talking again, right? So it's going to be like tennis today, right? I think the camera will be playing tennis. So it's the most challenging part, and in a way also because it includes so many different bits. So if I had to say to a doctor, remember to think about all the behavioral and psychiatric and intellectual and academic and neuropsychological and psychosocial difficulties in this child, they've fallen asleep because it's too complicated for people. So we wanted to think, how do we make something that's complicated simple to understand for people, right? So we know most people with TSC at some point in their life will have some of these difficulties. 90%, 9 out of 10. And in fact, even people who are incredibly intellectually able often have very specific difficulties, which means all of us are at risk of TAND difficulties at some point. And as you've heard, even in the UK, fewer than 20% ever had any assessment and ever had any treatment for these difficulties. I'll give you more examples in a minute. And there was also lots of confusion about the different language and terminologies that we use. So I'm going to show you some technical language, but these are all different words. So the psychologists will know many of these words, and you as mums and dads will have heard people use some of these words. Cognition, cognitive. How many of you have heard or used that? Behavior. We all talk about behavior. I don't know what that means, but people mean different things with behavior. We all have behavior. Neurocognition, neurobehavioral, neuropsychological, psychiatric, mental health, neurodevelopmental, learning, intellectual, mental retardation. We never want anyone to use that term anymore. That's an old term that people sometimes still use, or mental handicap. We don't want people to use those terms. So the term that we now use is intellectual disability or intellectual developmental disability. But you can see, these are all different things. And if you haven't heard about it, are you feeling confused just reading them? I felt confused. And then different professionals, different people mean different things with all the different words. And if you are in special education, like Shoba, she might mean different things. And if you're in clinical psychology, you might mean different things. So it's confusing. And that's why we decided we need to do something to raise the awareness and the attention and to make it simple for people to understand all the different components. Because TAND, and who asked the question at the end, TAND is an umbrella term for all these things. And so under the umbrella of TAND, you can have autism. So you can have both. It's one bit of TAND. But thinking about Raoul's example, autism may not be the only thing that's important to think about in your child. If it's useful, we will think about it. But if it's not the only thing, or if it's not useful, there are still many other bits that are part of TAND. So that's why we made up the word TSC-associated neuropsychiatric disorders. And I have to say, before we made it up, and we made up this term in 2012 when we wrote the guidelines in America. And why we did it was twofold. As you know, in TSC we have lots of acronyms. People talk about SAGA. Who knows what's a SAGA? What is a SAGA? Subependymal giant cell astrocytomas, one of the growths that we can get in the brain, for which people used to do surgery, and now we give medications. Right? SENs or SENs. So people use lots of acronyms. And so we thought we wanted an acronym as well. Right? The second thing is, I work in Africa, and we have lots of high rates of HIV. I don't know how high the rates of HIV are in India. Quite high, not as high as in Africa. And in the HIV community, people realized that they were getting good at finding HIV and treating the HIV symptoms, but they didn't look and think that people with HIV also have neurocognitive problems. It gives them memory problems and sometimes all sorts of other difficulties. And so they came up, the HIV community came up with the term HIV-associated neurocognitive disorders, HAND. And so we blatantly stole the idea from the HIV community because we said, well, if they can have HAND, we can have TAND. And I will tell you that many other syndromes have now started to talk to us and say to us, the things you talk about in TAND are very similar to the things we see in Down syndrome or in Fragile X or in any other condition. Can we use the same structure? And of course people can. So TAND was developed for people with TSC, but the principles are just as relevant to anybody who might have complex neurodevelopmental or neuropsychiatric problems. So anybody can use the structure in any way. So here it is. This is my favorite picture of the day. This is the TAND umbrella. Just to make it clear to us, it's a term that includes all these different components. And there are, you can see 1, 2, 3, 4, 5, 6 levels or bits to this umbrella. And I'm going to ask you, remember, I'm going to test you later and I'm going to get you to draw the umbrella. So you can take a picture of it now, that's fine. As long as you don't look at the picture later when I get you to draw it. Okay. And so the TAND umbrella has a behavioral level, and I will explain to you in a minute what I mean by that. It has a psychiatric level. It has an intellectual level. It has an academic level, a neuropsychological level, and a psychosocial level. So these are, and here at the bottom are just some of the examples. This is all in the paper that I'll give you a copy of as well. But if anybody wants to take a picture of that, I don't mind. That's for me a good way to remember and also to have a structure to think about how we're going to approach these difficulties. Okay? And I'll put that one up again. So what I'm going to do now, before we break for tea, what time are we going to have tea? Just after 11? Yeah, so let me just go through the umbrella and then we'll pause for tea. I'm now going to just go through all the levels and give you some examples, what we mean by the level and what the most common difficulties are that we see in TSC. And then you can think, is that relevant to me or myself or my family, or is it not? So the first one is the behavioral level. And as I say, behavior means different things to different people. All we mean by the behavioral level is it's the behaviors that you as family see, what you observe. You would say, I'm worried my child is aggressive. I'm worried they're not sleeping well. I'm worried they're not communicating well. I'm worried they are very overactive. I'm worried that they struggle with social interaction. So it's just what we observe. So we use direct observation or rating scales or all sorts of things like that. And as I say, almost everything is at high risk in TSC. Common ones: aggression, self-injury, attention, social issues, sleep. Do any of those ring a bell? Yeah? All right. We'll come back to them. Some of them we see more when people have intellectual disability, but some of them we see in anybody. So things like aggression, for instance, even kids who have very good normal development, typical overall development, we see aggression and aggressive behaviors. And so that's something that's an important bit to think about in TSC. And some of them we see more when people have epilepsy, but some of them we see in everybody as well. So it's not just, that's why it's important not just to treat the epilepsy, but to treat the epilepsy and the other things that there may be. So that's the behavioral level. The next level is the psychiatric level. So this is where we as mental health professionals will say, do we see enough of these things to meet the criteria for a specific disorder? So those of us who are in the business will say, I see a child, he or she has some language issues and some social communication issues. Do we see enough social reciprocal problems and nonverbal communicative difficulties and so to meet the criteria for autism? Or we see overactivity and impulsivity and so on. Is there enough to meet criteria for ADHD? Or same with depression and anxiety. So there's a process by which we get to a diagnosis. And the most common diagnoses that we see in TSC are the neurodevelopmental disorder, so autism. About 40 to 50% of people have an ASD. They meet criteria for autism spectrum disorder. And the same for ADHD, about half. Yeah. And then particularly from teenage years onwards, anxiety disorders are very common. And depressive disorders are pretty common. Just an example about diagnosis in anxiety. Colleagues of ours did a study of people with TSC who all had completely normal intellectual ability, and they found that 60%, 60, of all the people with TSC had an anxiety disorder, and not one of them was diagnosed with it, and not one of them had treatment for it. Isn't that strange? And the reason for that is because people see you and they say, oh, that's just the TSC. TSC makes you like that. But they don't think that there might be a TAND condition that we can diagnose and treat. And that's, in a way, the key message. For all the things we identify, there's something we can do about that. And that's why it's important for us to pick up. Okay. For mums and dads, but also particularly for those of you who are mental health professionals, if people have psychotic disorders, so psychosis means hearing things, seeing things, smelling things, becoming very confused in your thinking, that is not more common in TSC than in people in the general population. So when we see that, the clinical tip for us is to think it's most likely related to seizures. It's most likely epilepsy related, because we know seizures can make you hear and see and taste things and can give you difficulties. And then it means we need to treat the seizures as a priority, rather than to say this person is now developing schizophrenia or a psychotic disorder. So that's a really important clinical tip, because many people say, my 12-year-old is starting to see things, or is, starting to smell things or hear things. That's often not a psychotic disorder, but seizures that aren't so well controlled. Okay. So that's the psychiatric level. So you can see in TSC, you can have lots of attention difficulties and social difficulties and not have autism or ADHD. That's what's confusing to many people, but it's fine. We're going to think at each level, what are the challenges, and we're going to write them down at each level and think, what do we need to do to help them? Okay. The next level is the intellectual level. So now we're talking about people's overall intellectual ability. How many of you have had an IQ test? Yeah? Did you pass it? Hope so. Yeah. So many people have IQ tests, and this is the level we mean, your overall development. And all of us fall somewhere on, we call this a normal distribution curve, or a bell-shaped curve. And I usually explain to mums and dads, it's like height. If we saw how tall all of us were in the room, most of us would be average, some would be very tall, and some would be very short. It's the same with an IQ test. The child does an IQ test, and we see in comparison to others, are they sort of in the middle, are they much better than most other people, or are they much worse than other people? That's it. And when they are much worse than other people, relatively speaking, and they're in the bottom 2%, we say, and they're struggling to function in daily life, we say that they have intellectual disability. So that's how we diagnose intellectual disability. So it's this group in the bottom. What does it look like in TSC? Do you know? What does this picture look like in tuberous sclerosis? Okay, so in TSC, we see that this whole box is moved down. Yeah, so the mean for most people is 100. In TSC, it's lower. And so what that means is that many more people with TSC fall in the intellectual disability range. In fact, we say maybe about 40% of people with TSC have intellectual disability. But it means that the other half don't. Yeah? So many people don't have. In the olden days, people used to think everybody with TSC had intellectual disability, but that's not true. And but about a half does, and about a half don't. But the important thing for anybody with TSC, and I'm listening to what Rahul said also when we started, most people with TSC, when we measure our IQ, we do lots of different games and puzzles and it gets added up together. Most people with TSC have very uneven profiles. So there might be one thing that they do just as well as the other kids, or even better than other kids. And then they have other things that they simply can't do. And then they have something there, and then they have another one here, and then they have another one there. And that's confusing. It's confusing to us, and it's confusing to people who try to add up the numbers. So the main thing we say to people is never look at just the total scores, because they tell us very little about your needs or your child's needs, because in TSC it's likely to be all over the place. And that's why mums and dads get frustrated, because you might see, but she's incredibly good at puzzles, or she's incredibly good at this, but she really can't do that one. And then people want to say she falls in the global intellectual disability box, and she doesn't quite. Or they say she falls in the autism box, and she doesn't quite. You know, that's what makes it really hard for people with TSC. But it's just important to remember that it can be very mixed up. But I've worked with people with TSC who have incredibly high intellectual abilities as well. Still some unevenness, but very, very high. I mean, I had in the clinic a boy who had an IQ, for those of you who know about IQ scores, of 137. Is he having a seizure? Do you need to help him? Okay. So just do whatever you need to do to support him. Okay. Good. Is he all right? He's okay. Good. So if you need to take him out, do you all know where the bathrooms are? So feel free. Just do whatever you need to do to help him. Okay. All right. Okay. So that's the intellectual level. And you can also see why, sorry, just using your son as an example, why I think one of the reasons people forget about TAND is because particularly in the first years of TSC, for many people the priority is seizure control, because it's such an important thing. And it is super important that we find a way of picking up seizures and treating them well, because they influence development. So that's really important. But the important thing for us, the message to all of you, is it's important to treat the seizures, but also to remember all these other things about development, how do we stimulate development, etc. So it's keeping both those bits in mind for us all. Okay. So that's the intellectual level. The next level of our umbrella is the academic level. That's different. So academics is about reading, writing, spelling, mathematics, the stuff kids do in school. And the reason it's a difficult level is often people think that if you have normal intellectual ability, if your IQ is normal, you should be able to do these things. But what we see in TSC is there are kids, and they do fine when you assess their overall development, but they struggle very much in school subjects. And in fact, you can see here in the Tosca, that big study that I told you about, almost 60% of people with TSC had academic difficulties, regardless of what their intellectual skills were like. And so that's a problem, because often children then, mum and dad would say, you know, she has a normal IQ, and then school say, well, she's not doing well, she has to try harder. You know, that's often what people say to us. The most common area, I don't know how many of you have kids in school now who's struggling, the most common area where children struggle is in mathematics. We don't know why. That's the most typical area where kids struggle. It's mathematics. And we think it might be because when to do maths, you have to combine lots of brain skills. You have to hold things in your mind, you have to know things, you have to manipulate them in your head, you have to concentrate, it has some language demands. So it kind of brings together lots of things. Yeah.
Like with my daughter, she doesn't even understand after before.
Yeah.
Okay.
Yeah.
So, but in the process of making her try to understand what comes after, what comes before, like, or which one is bigger, which one is smaller.
Yeah.
So we would say, okay, fine. There are now this is 3, this is 6. Okay. So you draw. You tell me which is bigger. She and pick up whichever is bigger.
Yeah.
She would pick 6. But when she's doing her mathematics, she wouldn't draw the crocodile towards 6. Otherwise, she would put 6 because 6 is a bigger number. 6 toffees she's going to get, 6 candies she will be getting.
Yeah.
But when she's doing it on paper, then she will not be able to do it.
Yeah. So it could be about object and subject. So, but in a way, also what it's an example of is because it's the moment things get complex, and the next level I'm going to show you, when things get very complex, it can also be too overwhelming for the brain. And then when you just break it down and just focus on which is bigger, she can do it. And then there's another bit, which one, draw the crocodile, and she can do it. And then when you have to do them together, she can't. So that's another really important part of the challenges in TSC. So that very nicely, and in fact, that's why at the academic level, why we say every child with TSC should be considered for an individual educational plan, or whatever the term is. Is that the term you use in India? Yeah. An IEP. Everyone should be thought about. Do they need a special educational plan because of their profile? So can I steal a few more minutes before tea? Yeah? Just to get through my levels. Otherwise, you'll only get half of the umbrella, and that's not a good thing. The next level, and this is the level that's often the most difficult for people to understand, is the neuropsychological level. And I'm going to just take a few seconds to explain it to you. The neuropsychological level is different from all the ones we've talked about before, because it's the way that we try to say, how does the brain function in all the different bits of the brain? How little brains develop, like from his brain development to adult, or that one who's watching something on the screen, that's very good, is our brains gradually become specialized to do different jobs in different parts of the brain. Yep. And if I show you a picture of the brain here, when we do a neuropsychological assessment, we know that different bits are done in different parts. So we tend to divide the brain up into a left and a right and a front and a back and an inside and an outside, very simplistically. And the left of our brains typically usually specializes in language skills. The right-hand side more in visuospatial, visual things, spatial things, attentional things. The back of our brain is usually where we store information, and the front of our brain is usually where information is produced, where we have to organize things and produce things. And so we can use all sorts of different games and puzzles and things to build up a picture of where your brain is good and not so good. And in TSC, as you can imagine, it's also all over the place. But there are some areas where we know there are particular difficulties. So let me show you some of those again. So that's, here you can just see, in typically developing people, all those different brain skills are usually the same length, if I can use it like that. In some people, most things are good and a few are bad, but this is kind of what it looks like in TSC. All over the place. So some people have very good skills in one area, really bad skills in another. And you can see why that makes it hard if we just average things out. There's no such thing as an average person with TSC. We all have a very different profile, right? So that's the key thing to remember. But here are some of the things that through our research we've discovered. Many people with TSC struggle with memory, okay? And they specifically struggle with what we call recall memory, remembering something, being able to say, when did you do that? What happened? Not in recognition. If you show somebody with TSC 2 pictures, they can recognize that one. I've seen that one, I've not seen that one. But if you get them to produce, that's hard for many people with TSC. Executive skills is hard for many people, and I'll just show you an example. Planning, organizing, tracking what they're doing is really difficult for many people with TSC. That's the front bit of your brain. Attentional skills. So being able to focus, being able to concentrate for a long time, and particularly being able to do 2 things at the same time is super hard for most people with TSC. So the example of the maths could be about attention, about doing two things at the same time. So many people with TSC can do the one task, and they can do the other task, and the moment they have to do them together, it all falls apart. Yep. And so if you've heard me talk before, I always say all men and most people with TSC have difficulties with multitasking, right? So, yes. And it is, so far, it's the most common difficulty that we've seen across all people with TSC. Young, old, men, women, every skill. So, and often we miss looking for that and picking it up. And how, when adults have TSC and they have dual task difficulty, the way they describe it to us, and it happens in children too, is when the load on their brain gets too much, they feel overwhelmed. So it's a sense of anxiousness. And then often it also is accompanied by that anxiety presents itself often as aggression and irritability. So just for us to bear in mind, one of the reasons why we might see somebody becoming aggressive or irritable could be just the sense of feeling overwhelmed neuropsychologically. Yeah? So you can see some of these things are quite subtle but very definite challenges for us. Do you want to do a quick little brain test of your own? Let me show you one. I'm going to show you this one. So I'm going to make you do a planning test. So planning is the ability to plan the steps ahead, okay, to know into the future. So, and a very common task that we use, I don't know if the psychologists here use it, is something called the Tower of London task. So you have a little board and 3 little balls, a green and a red and a blue one. And one peg can take 3 balls, and one peg can take 2, and one can only take 1 ball. And you can only move 1 ball at a time, okay? So let me show you this one. So for instance, this one, and we would say to the kids, we would give it to them to do, how many moves do I need to make the bottom one look like the top one? What do you think? This is just 1. Why is it 1? Because I just take that blue one and I put it there. Yeah, okay, is that easy? Hopefully. Were you all able to do that one? Good. Next one. How many moves do I need to make the bottom one look like the top one? Here. Some say 2, some say 3. You can only move 1 ball at a time. You can only move 1 at a time. 3, why is it 3? I need to move this one there. Then I can move this one there. And then I can move this one there, right? Okay, good. Next one. How many moves do I need to make the bottom one look like the top one? In a way, the answer is not so important, but what is important is what I can see from the front. I can see you all going. That's planning, yeah? Because you think, okay, if I do this, then I need to do that, then I need to do that, then I need to do that. Yeah, that's planning. So this is kind of planning in action. And we need to plan getting up in the morning and making tea and making whatever. Do you do toast? No, maybe whatever Indian breakfast you have. And that actually, planning is actually really difficult for many people with TSC. Sometimes because just that pure planning is a problem. Sometimes also because they get distracted attentionally. So it's a real area of difficulty for many people. And so are many of these other things. We can do lots of games. But this is just to illustrate that brain-based skills, if we can find a way of evaluating somebody's profile, we can think, you are really struggling with this particular brain skill. Let's think what we can do to help you develop that brain skill. Because for all these brain skills, there are tricks and games and things we can do to help improve them. Okay. the last level of my umbrella, and then we'll have T, is the psychosocial level. The psychosocial level is the level where we think about what is the impact on not just the individual, but also the family system. And often people forget. People say, yep, your child has autism, yes, your child has intellectual disability, yes, your child has ADHD. They don't think about how does it make people feel, the individual? How does it make mum and dad feel? What does that do in terms of the burden, the stress on family, on parental relationships, on siblings, on grannies and grandpas? And the reason we wanted to spell this level out is often, therefore, when people go to doctors, to neurologists, to pediatricians, they forget to ask, how are things going? How are you dealing with it? How are you coping? How are you feeling? And sometimes just asking that question and giving people permission to say, do you know what? It's really hard, is in itself a powerful intervention. Just not ignoring the importance of this level. So that's why we wanted to make sure this level is also there. So here they all are. Now you know the TAND umbrella: behavioral, psychiatric, intellectual, academic, neuropsychological, psychosocial. And each person will have a different combination of things in that, under that TAND umbrella. Some people might have very few, some people might have lots and lots of difficult issues, of different issues. And that's why it's important that we say, so everybody should be evaluated for their TAND profile, and we know it can change over time. That's why we also say people should be re-evaluated at different time points for their TAND profile. Let's stop for a cup of coffee, and then we'll come on to the checklist and some research and etc. Is that a good place to pause? Let's pause.